Hello, everyone, and welcome to Rare Connection, the podcast where we connect patients, advocates, researchers, clinicians, and industry leaders to raise awareness for rare diseases and the research bringing hope to millions around the world. I'm your host, Joanna, and at Rare Connection, we believe that breakthroughs often happen when we connect ideas across disciplines. Today's episode is a perfect example of that. Most people think of veterinary medicine and human medicine as two separate worlds. But what if the treatment originally developed for a cat could one day help people? That's the promise behind the concept of One Health. The idea that humans, animals, and plants, environmental health, are deeply connected. Today's guest is helping advance research that could benefit both animals, people, reminding us that medical discoveries don't always stay within one species. Before we begin, please remember that this podcast is for educational purposes only, and is not intended to provide medical advice. Always consult your healthcare provider before regarding your own medical decisions. Today, I am excited to welcome Dr. Maggie Placer from EveryCat Foundation.
Thank
you. EveryCat Health Foundation is one of the world's leading nonprofit organizations dedicated to advancing feline health through research. While many people know the organization for improving lives of cats, some of its work also highlights the growing importance of One Health, where discoveries in veterinary medicine can lead to advances in human medicine as well. One exciting area of research involves feline leukemia, antiviral, that researchers are now exploring for its potential role in preventing long COVID. It's an incredible reminder that scientific breakthroughs can sometimes begin in unexpected places. So, Dr. Placer, welcome to our connection.
Thank you for having me. This is fascinating what you do, tying all of us together. So we're very happy to be here to share with you and your audience how helping cats not only helps the cats, helps those cat caregivers enjoy their cats longer, but also can help their own human health. So I do have some slides to quickly take us through the kind of what EveryCat is about, our history, our 60-year history, and then yes, we'll get to those translations.
Okay. Oh, are these okay? I think I have those.
Yeah.
Yeah, there's that one.
Perfect. Okay. Should I click present or anything, or just get started?
Oh, there's a little slideshow here. So yeah, did you want to go into the next one, or just let me know when you want to move on?
Oh, sure. Let me just see if I can make it a little bigger, or okay. As long as you can see me, I'll just make it bigger on my end. Right, thank you. I love being, so I'm the veterinarian on staff for EveryCat, and it's like a dream come true. I get to be a feline medicine cheerleader. As a vet, I love all animals, but cats really have my heart, and so I'm still more used to or more accustomed to the exam room than a podcast. But I'm happy to speak through these. So yeah, definitely. If you want to be the slide controller, we'll kind of go through.
We can do that.
Thank you. So yeah, next slide. So essentially 60 years ago, cat lovers, breeders just realized dogs are wonderful. I love dogs. We just knew more about them than we did cats, and cats are not small dogs. They're a different species, just like a human and a dog are different. So there was an effort to really, let's learn more about this unique species. How can we help them? And what we're getting to today is looking at cats as a unique species with their own diseases and own needs has helped human research and treatment. So 60 years ago, we'll kind of keep going, but we started very small, but we continue to grow. So celebrating 60 years, you can advance, Joanna, thank you. And I could advance.
Oh.
I'd say I'll do the slides if that's easier for you. So yeah, excited.
Oh, okay. I didn't know you could. Okay.
I think I can. We'll see. We'll figure this out together. So yeah, 60 years of the main thing we're going to look at as far as those antivirals, 60 years ago, there was it's a feline coronavirus. That's, the buzzword. COVID is a human coronavirus that was just killing cats. And so efforts were made to say, what's going on? What is it? What can we do about it? So we'll get to that in a bit. But 60 years ago, there was really a push for just the basics. I'm told at one time you could buy a can of animal food and it could be used for a dog or a cat. Well, a lot of cats were having heart issues because they needed taurine. I know you know a lot about amino acids and what you shared with me, and that cats were dying of basically heart disease, dilated cardiomyopathy, because they weren't getting that in their diet. Not millions weren't spent, but thousands were focused to, hey, what's going on here? And because cat diets have been changed, seeing that they need something different from dogs, countless number of cat lives have been saved. So had to start with the basics. What's their normal heart rate? What's their blood type? Because they aren't another species. And now as 60 years goes by, we're trying to get more into, okay, we know the basics. What are their diseases that still plague them? And then how can we help them? So I know while we're, hopefully it's an audience of cat lovers, I'll keep things moving here. So there we go. Okay. So yeah, started with that $1,000 grant to look into. So FIP is the feline coronavirus that results in FIP. It's feline infectious peritonitis, big term for, basically it was a disease that was fatal up until about 7-8 years ago. I've been out of school 12 years, and I remember having to tell a cat owner, and it affects kittens and sometimes older cats, that there's nothing we can do. It's heartbreaking. I can take myself back to that room in Chicago where it was just, you felt so helpless, and it was just a tragic experience. So through funding studies, what is this disease? How can we help it? We'll see how we help the human side in a few slides, but really EveryCat was established to essentially say, how can we help cats? What do we need to know right now to help the most cats? And that's what we continue to do through these 60 years. So studying of the heart, we talked about that taurine deficiency. It can be confusing. There's some major cat viruses out there. So FIV, feline infectious, feline immunodeficiency virus, sorry, even I'm still tripping on them this many years into this work, is like HIV in cats. Feline leukemia virus is another virus like FIV. They can get it from cat bites and saliva and things. It increases a cat's rate of cancer and can limit their life. FIP, it's a coronavirus that cats get that changes in the animal and develops into a disease that, again, up until about 7 years ago was always fatal. So it just plagued cat lovers. Another thing on our highlight list, just to bring you up to speed over the past 60 years, we think blood pressure might be a frivolous thing in a cat. Well, we adapted pediatric little monitors, little blood pressure cuffs for use in them. Kidney disease plagues cats. blood pressure is important. If it's out of control, things are going to be exacerbated. So these little things that might say like, oh, some might say is a silly little study. Well, no, especially if it's helping human medicine, but it's helping cats, and cats are known to be a species that hides their needs and things. Again, I think I touched on, let's see, I might move it along right here. Yeah, blood groups. Also, the idea that cats could safely be spayed or neutered earlier. That helps animals move out of shelters. It just, we didn't want to do harm, but we wanted to expedite getting them into homes, and those studies allowed us to do that. Looking into, I know, the podcast sounds like looks at rare diseases, maybe in any species, but in our world, or in the cat world, we have diseases that are unique to certain breeds. So it really can get very down into what's going to help those animals, like in where we hope human medicine is going. We are getting into a place where could we swab a cat's cheek and see genetically what they're predisposed to? So then we have a guidance on how often should they be screened. In the world of people breeding cats, should that be done if this cat has that disease? So this idea of almost precision genetic medicine to say, how okay, in this animal, or human, what do we know to watch for? And then there's also the goal to get to the point where, say you have a cancer and they take a biopsy of your tumor. Let's look at the genetics in that tumor. How could we exactly help that individual the best? And actually, what we'll get to another translational study we did where studying cancer in cats stands to benefit humans with breast cancer. All right, so moving along. Let's see, so there we go. It's kind of like a viral. There's a lot of viruses that we're still tackling for cats, but like you said in the intro, studying those viruses has helped us, because coronavirus was talked about again 60 years ago in cats. It hit the human side or got a whole lot of attention recently, and it was fortunate that we had that bank of feline research as a springboard. That's right, we mentioned Sylvie. As far as medicating cats, and to maybe not a cat owner, the use of transdermal or on the ear medicines, medicating cats is not known to be easy. So the idea is right now, not every medicine can be made into a transdermal or absorbed through the skin medicine. But because of the rise in cat owners, cat lovers efforts for cats, we're seeing the development of, say, an arthritis injection that lasts a month, or medicine that may be easier to give, flavored or smaller, or tastier, or again through the skin. So just efforts to meet cats where they are and what they'll tolerate. And then I think this brings us up to the FIP conversation. Okay. There we go.
Yeah, Sylvie doesn't tend to tolerate anything in her mouth or ears or anywhere else but cat food.
Okay, yeah, and then so medicated food has been on the rise, and then if the cat's eating a food, you really, I'd be afraid to rock the boat. You don't want to add something. So we definitely are their managers. We live at their beck and call. More things, stem cells. Again, FIP will talk about more so, and then one thing is interesting is there was an outbreak of this feline coronavirus in the Cyprus, Greece area. And what we'd always thought is cats that have this feline coronavirus, it sometimes upsets their stomach. Most cats get over it. Some cats, though, just like you or I may get the flu, some person may get sick, someone might be able to clear it. Kind of depends when it hits their immune system and what else they have going on. We were seeing that while this feline coronavirus usually played out that way, 15,000 cats we knew were affected severely by this by a form of the feline coronavirus in the Greece-Cyprus area. So it got the attention of ourselves, EveryCat. We partnered with Moore's Health Foundation to say, hey, what's going on over there? How do we help those cats? Could it be that this virus has changed and is now going cat to cat? And in studying that, so a few things. Of course, we want to help the cats. We want to empower those taking care of the cats, because I haven't traveled, but I've seen enough videos or read enough to that area to see that it's a street cat population. So we definitely wanted to help the people there. And then in doing so, we further learn how to help cats here stay ahead of another outbreak. And the research that we did has actually been published in Nature, two articles. So that is valuable to any scientist. So for those into your academic publications, anyone interested in any coronavirus, human or animal, it's important that we track how they're changing. Yes, in one species, but they're so advanced and in ways ahead of us, it's good to kind of track things. So that was an effort where we've always been studying diseases and trying to cure the things we knew about cats. This was an outbreak where we said, hey, let's not sit back and see how this plays out. Let's be a little bit more, aggressive there. Okay. My veterinary technician, I have a mobile practice down here in Louisiana. I'm glad she printed out the slides for me. She knows I'm tactile. In the past year, so 27 different grants, different topics, 5 different countries. So EveryCat is all for where can we do the most good with the funds that we have, help the most cats. And over $1 million was able to be dispersed in funding. In the 60 years the foundation's been active, about $11 million has been directed specifically toward feline research with strong humane ethical standards to make sure the cats are treated well. And it's very much not, it's not, I wouldn't think of it as white coats, cats in cages. Thankfully, we were able to, if you submit a biopsy from your cat, that can be frozen and stored. And honestly, here's a fun word, organoid or tumoroid. We can grow what we want to study from what was collected. So definitely not imposing upon any animals and changing their, cats deserve the best, and that's what we want them to have. And just again, in summary, the studies we're funding are covering all different areas, still tackling the coronavirus as it pertains to multiple species and still an issue for cats. One thing I'm excited about is a feline-specific quality of life scale. We know they are unique, they're good at hiding things, and those kind of later years are real important to help them where we can. So I think here we are, what kind of got your attention is, well, this is the work we did in the Cyprus, Greece area to really tackle, hey, what's new? How is this virus changing for cats over there? And again, it resulted in a lot of publications. It's just, it just shows that because we were able to, we have the researchers, we have the funding to say what's going on here. It's resulting in documents that again help both humans and animals. Okay, this is really kind of what got our conversation going. So EveryCat started to look at coronaviruses in cats again 60 years ago. They were dying. We couldn't understand why. Dr. Niels Peterson is revered by cat lovers in that he took drugs that were used for treatment for HIV that weren't working out there and tested them to say, hey, could those antivirals help cats? And some of them did. Now, of course, which I don't claim to know everything about who owns what drugs and when you could use them and what species they're allowed to be used in. It took several years for these drugs to be able to be used in cats in the US. So you can imagine a lot of cat owners will, or you value any life, you're your own, your dogs, you might go elsewhere, you may, try to buy things, places that aren't regulated to try to help your cat. So what initially showed hope for these cats that were dying of the disease from this feline coronavirus took time to refine injections versus pills. And then the final hurdle became the legality of it. So he started this work, I guess, probably 60 years ago is when he started studying what is going on, what is this? And then over time he got to, hey, could these rejected HIV drugs help cats in this situation? So he's starting to do that in, say, the 90s, 2000s, and then we're kind of up against, cost and also can't get them legally in the US. So that was, say, 90s, 2000s, fairly far back when we think of COVID-19. So COVID-19 then hits the human world, and those in gearing up to treat humans said, okay, this virus, so a family of virus is a family of virus. What do we know about it? How has it been helped? What's worked where? So the drugs that were a form of the drug that was able to help cats is tied to remdesivir, which helped a lot of people affected with COVID. So because of what we had documented in cat research, that was a springboard for treatment in the human world. And so that saved a lot of lives just because that was there for them to say, hey, let's try this one, let's go. Of course, time was of the essence. More recently, as we're able to legally treat cats that have this feline coronavirus disease, we're able to track how they progress with treatment. And so this started years before COVID-19. So in tracking how those cats are treated, we have kind of a precursor template or precursor model of how of long COVID. So studying those cats to say, hey, what can we expect from long COVID? And then also the development, the testing of a drug for a coronavirus in general was a springboard for a treatment of COVID-19. So that's kind of the main translational aspect there. Let's see. And then the other study I wanted to, I'm happy to elaborate on anything that interests you, that most recently, this past year, there was a study, a lot of collaboration in Europe and the US, about, I think, 500 samples from, again, stored, no cats were affected by this, were tested over 13 different cancers to look at the genetics in each tissue sample. And they had normals and they had the cancer ones to compare. And in a lot of things were found, so dogs have helped human medicine as well. We're all, one team here. So what was found in this study is certain ways to help certain cats with certain cancers, certain ways that a treatment used in a dog could help cats, just based on what the genetics have been done in cats. But most promising, so this was published in Science. Again, when they have these more broad terms, it means it benefits the whole scientific community. So what was promising there is the genetics we found in mammary cancer in cats stands to benefit treatment. Again, the goal of that precision treatment, like your exact cancer, how can we best help you, we seem to have there's a hope and a platform for a treatment that could benefit cats with mammary cancer, humans with breast cancer. They tested 13 different cancers, so mast cell tumors, colorectal, different ones, but the one that showed the most promise as far as that stands to help cats and humans is mammary cancer. So from that study, we have a lot of springboard to help cats with those cancers. Great. Excited about that, and then this additional benefit of potentially helping humans as well. So, excited about that. And then kind of another, just again, the whole topic of cat research helping human research, hypertrophic cardiomyopathy. So I think there was a movie with Tom Hanks, and he had a cat in it. Was it A Man Called Otto or something like that? In it, I just remember. Yeah, you got it. In it, he had this condition, hypertrophic cardiomyopathy. Basically, the walls of the heart get really thick, and so they can't pump blood. The chambers get smaller because the walls get thicker, if that makes sense. But it has kind of like coronavirus plagued cats for years. A lot of cats have had have had HCM, so it's something that's been on our feline medicine radar for decades, and so the work has been done, the cats have been studied again. I imagine the human researchers probably sift through a lot of things, but they need a springboard or a guide to guide their research dollars, their focus, the precious time those patients have. So if, this fact here that Dr. Joshua Stern is really a leading cardiologist in veterinary medicine, we work with him out of North Carolina State, but he kind of clued me in. The way he phrased it is, if you have a human family member, loved one who has HCM or hypertrophic cardiomyopathy, you should thank the EveryCat Health Foundation, in that it's a disease we've been tackling in our model for years. So common in cats, 1 in 7, 1 in 300 is still pretty high in humans. So it's something we've been tackling for a while. Cats would die suddenly from this. It doesn't always show symptoms. So still ways to go. It's one of those that in certain breeds, we're hoping to be able to swab them to say who's at higher risk, or blood tests have been developed to say, especially before anesthesia, to be spayed or neutered, is their heart one that needs a little more, closer watch? And then something interesting Dr. Stern shared with me is there's two, I think he said if you watch, late night TV commercials or whatnot, but there's two, drugs currently being, FDA approved and being marketed that were initially studied in cats that are helping humans. So those are just kind of course, the coronavirus impact was so significant. Excited about that cancer study and how the genetics in tumors could help any species, and then even better if it can help multiple species. And then more recently, the conversation of, hey, all this work we did to look at this heart disease in cats has been able to help the human side as well. Yeah. So I can go into more things about EveryCat, but if you have any questions, my little PowerPoint's just kind of EveryCat.
Yeah. So I was going to start out with your history here. Yeah. So can you tell us about your background and what inspired you to become a veterinarian?
Yeah, thank you so much. So I am from Lafayette, Louisiana. That's where I currently am back home. So I guess my background as far as becoming a vet, I had interest in, I guess human medicine or being a physician, maybe potentially pediatrics. I think in 8th grade, I went to like a med school camp. I did also, though, work at a kennel at 16. A friend's dad was a veterinarian, and I really appreciated how ironic, or I guess kind of morbidly, the vet I worked for was giving a cat piece owned by an older lady, and I was part of that experience. And the way he just carried the cat out and showed respect and cared for two beings, the human and the cat, I really respected that bond and the ability to help both at that time. So always an animal lover, interested in medicine, kind of steered towards, I guess, veterinary medicine after that kind of teenage experience. So I went to Louisiana State University, Baton Rouge, Louisiana for undergrad, Purdue University, ironically in West Lafayette, Indiana for vet school, participated in a ABVP residency in feline medicine. So it's relatively newer in the vet world. You can specialize in a species. And then I worked in a few different cat practices in Texas, Chicagoland area, Indiana, and then I moved back home about 8 months ago. Still work with dogs as well, occasional goat, rabbit, chicken maybe, but the focus is cats and dogs. And I have seen the real need for, I have a mobile practice here, so I go to people's homes. So some animals don't like to travel. Some animals, it's stressful on the owner for them to travel. So I'm kind of that in between, and I thankfully have good relationships with the brick and mortar clinics here. Then the EveryCat Health Foundation did not have a vet, so the staff is very small. The goal is for funding to go to research. So they created a position to have a veterinarian just to kind of act as a liaison between the researchers and anyone asking any questions, and engage with the vet schools, and also speak, just the public, just to have a vet to kind of answer some questions. So that position developed about 2 years ago, and I've really been enjoying it. So it's part-time and remote, kind of family member had some health issues, was able to move back home, travel when they need me, but also, keep my hands on animals with the mobile practice. So that's me. And I have one cat named Bobby. She has a little bobtail.
So how did your career lead you to EveryCat Health Foundation?
Yeah. So I was working kind of like a general practice, 8 to 5, what have you, cats and dogs. And I just thought, a lot of times you'll hear in our vet circles that some cats, they see cats because they have to see dogs. Some vets are kind of like, let's get through this to see the next dog. They're just more comfortable maybe with that species. So I thought to myself, I've been involved with the Feline Veterinary Medical Association, just always a cat advocate. And so when I saw it was posted on the AVMA, American Veterinary Medical Association, all these abbreviations, that EveryCat was looking to take on a vet basically as just a champion to speak about what they do and share about what the organization is. I mean, I did not know this foundation existed when I was in veterinary school. It had a different name, but it did. I would have been excited to have known about it, so anything we can do to make a species less intimidating to students in vet school who were learning horses and geckos and everything. So anything we can do to engage the already cat lovers, make cats more understood by those that will be engaging with them, I thought was a great thing. So the opportunity to be kind of like a cat cheerleader, a cat advocate was exciting. The grants part of it is not, again, I'm not an MBA, I'm a DVM, but I am, thankfully able to have good support on the administrative side to make sure that things are done, of course, appropriately, and just learning, spreadsheets and all that stuff when I was used to, stethoscopes.
Mm-hmm. So what is your current role at EveryCat Foundation, and what does a typical day look like?
Yeah, so we we're a small staff, maybe about 7. 3 of us are part-time, I think. The male goes to New Jersey, but we're all over the country. We're really only together when we're at a veterinary conference or a show to kind of where we booth, have a table to interact with people. So those days are long days of being at the booth, as long as someone wants to talk about their cat or what we do. So actually, we're going to be at Louisiana Cat Fest, which happens to be in my neck of the woods tomorrow. So when it's engaging with the public, it's from setup till takedown. Otherwise, it's kind of as a staff, we have a a huddle Zoom meeting once a week to check in with each other, but it's a lot of emails, keeping up engagement. And then as the veterinarian on staff, I do get to have a presence at veterinary conference, cat shows, anywhere we think we could help spread the word of who we are, what we do, and engage with others. So it wasn't my, I guess, upbringing on the request donation side. I do understand how things work. So I love to talk about the medicine and what we do and engage with people as to how they have been impacted. We do have a tremendous volunteer network that's growing, and that's great because, again, staff, we try to do all we can as a staff, but we, again, want the funds to go to helping cats. So the volunteer network is tremendous, and so it's not like you sign up, you must do this as a volunteer, what have you. It's whatever strength you want to share. If that's editing a letter or talking about your experience with your cat, if you are up for sitting at the booth, representing EveryCat, giving out little EveryCat stickers and pins and stuff in your area, that's great. That gives us more, spreads us out, gives us more kind of boots on the ground to promote helping cats. So it's kind of some office work, but also it is nice to be able to get in front of people and talk about what we do.
Yeah. So what originally drew you to feline research?
Yeah. So the fact that we just didn't know as much about them. So it was interesting. It was great. We had an opportunity to speak with Emily, I think Anthes, A-N-T-H-E-S, is her last name. But anyway, she's a journalist with the New York Times. She published an article about, I guess, a year ago, it was January, why is feline medicine kind of a black box? And in that, she interviewed a lot of course, great researchers, people contributing to research. And she kind of was polite of her. She squeezed me in that. So I graduated 12 years ago. So I was studying animal anatomy 16 years ago. Our book was the dissection of the canine. And we'd get like a PowerPoint or, supplemental material on the cat. So you just knew that it's great what we know, but we know we're behind because, again, what we're learning is the different species and extrapolating where we can. So as someone my first best friend was my cat, Callie, just always loved cats. I was like, I love what we know. We need to know more. And then, of course, they're, a magical little enigma in that they're hard to figure out, but they're worth the challenge, but then they hide things. So it is definitely one that those of us passionate about cats are willing to do what we can, engage who we can, to meet cats where they are, to help them, even if they fight us. It's tough love sometimes, but also it doesn't have to be so tough. It's better on both sides. Stress is not good for any species, as we know. But it was really the void of knowledge was evident. And it was great to find others who were kind of on this crusade for cats.
So for listeners who may not be familiar with EveryCat Health Foundation, can you tell us about the organization's mission?
Yeah. So it's essentially able to support studies. So, sometimes the term research can seem a bit stiff. So feline health studies that are where we'll do the most good for the most cats. And on top of that, then educating the veterinary community, owners, everyone, which is a big goal. So we primarily try to fund these. So I'll mention this just to kind of understand what we do. Twice a year, grants, or when I was new to the grant world, you could think of it like science fair projects or, proposals for work people want to do come into the foundation. We have, I call it like a super Zoom of I think we're up to about 30 specialists who volunteer their time to review these grants to help us rank them and say, where will we do the most good with the funds that we have? So this is worldwide, all over the world. People send these grants that are reviewed by specialists and, from infectious disease to behavior, to say, again, and they volunteer their time. So that's in-kind hours. It's tremendous. And so, these are the people who write the textbooks, speak at veterinary conferences. They just care about cat medicine and guiding us to do the most that we can with what we have. So out of those grant reviews, we can never fund all that we want, but we do fund what we can. And then it's kind of my job to collate or add together the feedback from the reviewers. For those that don't get funded, I send them the reviewer comments so that they're hearing from people who are well published, these specialists that say, hey, thank you for what you shared. I think it could have been stronger here, here, and here. So while no one wants to be told no, or, not get funding, because we take that time to give that feedback from these specialists or, people who are so prominent and successful in the field, that feedback, we hope, goes back to the researcher to say, okay, let me make this better and try again, or make this change in my next publication. So even though we can't fund everything we'd like, for those that had a place for improvement, we hope that our efforts of sending back the reviews that could just only make them better are taken that way, to strengthen them, to strengthen their research, so that it is something that we couldn't help but fund the next time. So we are kind of the fund research area, but we do encourage education. We do sometimes, or we do just for size, bandwidth, have to lean on the Feline Veterinary Medical Association or different conferences to then share the things that we come up, or the things that are published. I learned recently, I think it takes about 10 years actually for, say, a study to be published, for it to kind of say it's made its way to all the veterinarians that could use it. So any way to speed that up, of course, internet and all the resources are probably making that fact hopefully passe, but it was enlightening to know the lag from news to application. Again, hopefully social media, a lot of things can speed up that knowledge, train.
Mm-hmm. So what types of research does EveryCat fund?
Yeah, so there's definitely, as a cat lover or anyone who knows cats, where we haven't given up on the old, people say feline kidney disease, why can't we tackle that? A lot of different ways we're coming at that. That's still being funded. Cancer treatment, there's definitely we fund studies tackling that in different avenues as well every cycle. So the issue is that, feline coronavirus, when it was killing cats, that took us 40 years to really tackle the disease, come up with an option that worked. And it doesn't mean, I guess one of our board members, Steve Dale, recently said, like, if we could cure that, why can't we cure the other things? So it doesn't mean, hopefully, it doesn't take 40 years, but we are still going after the things that plague cats, certain cancers that are just aggressive, those of the mouth, or just those that move fast. Kidney disease continues to plague cats. We're coming at that in different avenues. Behavior studies, so you think of that as softer science, perhaps. However, how important is it that a cat doesn't get stressed, or that they take their medicine? So those are basics that we need. And those can be sometimes harder to study or harder to fund because, say you're doing work on biopsy samples that were collected in a lab. That's awesome. It's great. Everything's there. You just make sure you do it right and you're good. With a behavior study, you're engaging with animals, has to be done to certain standards. The humans involved have to behave certain ways. So we're excited when our behaviorist experts really believe in a behavior study, because it's just the nature of the field. There's other boxes they have to tick that make it a little harder for us to say, you got our stamp on that, versus, say, working with tissue that was already collected. So yeah, I guess to take it back, if the question was the mission, it's research and then support education as much as we can, realizing that we're happy to be the research engine and give what is found to the outlets that can share that with the public.
So you mentioned kidneys. I've had a lot of cats die from kidneys problems.
Yeah.
What's new on the horizon there?
Yeah. So I know that we're kind of one of the studies recently funded is looking at the best antibiotics for treating kidney infection. Now, renal infections, kidney infections aren't always the push, the stimulus behind the decline. But when an animal does have them, and again, cats can hide things, if an infection gets ahead of us, we need to know which antibiotics is going to work the best. And then just like tracking long COVID, how long should you treat for, things like that. It's best to know what antibiotics should we go to first, how long should we use it. And then with antibiotics, we'll always want to be cognizant of the fact that the human side needs them too. So judicial use of antibiotics. So in studying what can help them more quickly, and for what duration, which one's best to go to when you diagnose it, how long should they be on it to avoid side effects. So it may sound like a subset of cats with kidney disease. It's more common than you think, but in them, it's pivotal. So we're really trying to, we haven't given up on nutritional changes, and we know the basics of hydration as a benefit. And, why is it that around age 10, we start to worry about cats have these changes? It's definitely one that researchers continue to look at from different avenues. The incoming chairperson for EveryCat is a specialist in nutrition, so that's not something we're shying away from. It's just it's a complex process. Is it an aging change? Is it a cancer change? Is it a inflammatory disease? Is there an infection involved? So it's one that continues to be tackled. And when I hear who submits grants to us, I'm like, oh yeah, I heard her talk at that lecture and that lecture. I would have bought a poster of her in vet school. She's the queen of kidney disease. So there are these veterinary professionals that also teach at their universities, and also research that are just really putting this is their lives work into curing these things for us. So it's really exciting to see these people who, again, it's their lives work, the champions of this specific thing. And as long as the other reviewers see benefit in what they're doing and the funds are there, we're going to stand behind them as we continue to advance and help cats. So these things that are like, oh no, kidney disease, yeah, I've lost cats to that, it's heartbreaking. Yes, I do believe that we are getting closer with blood pressure, that not every cat will let you test it, things like that. But things that allow you to slow a process that for now is not completely curable gives you more good time with your cat. So while we ultimately want to cure, we keep in mind that the cure is going to be kind of different, but also why do their kidneys seem to wear out? We're still coming for that one. So kidney issues, GI is always a big thing in cats as well, cancers for sure. And then again, behavior, I mentioned, it's not always as easy to fund because of just the things involved, but we are excited when we do fund them. And I would mention most of the research that we fund is through universities. There are some private institutions as well, and then some practices, that feline quality of life scale that's being developed specifically for cats is out of a larger practice in Colorado. Another private entity in Chicago is working on a more effective feline herpes virus vaccine. So even the things that we think we have a handle on, if someone says it's okay, but we could make it better, if they convince the specialists that review the proposals that, yeah, you're onto something, it stands to get funded. So it's very exciting to see these people who are passionate then getting evaluated by people who are equally passionate, so that we come up with things that this has the best chance to make cats' lives better, and therefore we make the lives of the cat caregiver, cat lover, family member, what have you, better as well.
Mm-hmm. So how are research projects selected?
Yeah, it's a good question. So evaluated on, budgets are always scrutinized. It comes down to how will the most cats be helped. So I know that sounds like I've probably said it a few times, it's a good little motto. Mm-hmm. You can imagine it comes down to a debate of this disease is not common. However, the cats that have it have no options. So those get championed, especially by people who had those cats or just said, this study may help cats take their medicine better, but this study is going to develop a surgical procedure that helps cats with shunts in their brain that they have no other option and they die if it doesn't get fixed. So it is, to me, it's a beautiful thing to watch these researchers, academics debate kind of, I see that, legitimately we have a spreadsheet, it's a 4-hour meeting, and they're moving things up and down as to, if they, and then sometimes we will say this, if you change this in your proposal, we will fund it. So it really is, it comes down to how many cats are affected, how much does it stand to benefit cats in general, and then I guess how frugal, or, definitely the budgets are scrutinized. They have to submit progress reports, financial and scientific, every 6 months. If it's a 2-year study, studies are usually 1 to 2 years. And so it definitely, you have researchers who have fought for their own research dollars scrutinizing these proposals. So it really is the focus of what do we have to give, what warrants what cost based on their own experience doing studies, and then who will be helped, how much is the topic needed. So all those factors come into how we rank what's picked.
Mm-hmm. So can you share a few discoveries or projects that you're especially proud of?
Yeah. So I think, well, again, so I'm in South Louisiana. It's fleas. It's hot. We see a lot of cats breed, or animals, cats, dogs breed year round down here versus areas with snow. So we see a lot of stray animals, and I've seen I remind people when a flea bites a cat, so it bites and they might itch, sure. They take blood, so they're little like vampires, and they can transmit bacteria. I've seen a lot of cats that were basically almost little kittens sucked dry by fleas, or for another reason had low blood, needed a blood transfusion. Sounds extreme and could be thousands of dollars at a specialty facility in a big city, but not necessarily. So in where I am, Lafayette, Louisiana, or the rural areas around it, if you know what blood type a cat is, you could give it blood. And it doesn't have to be an ICU 24-hour care, but that cat, it doesn't, you don't have to be a veterinarian to realize it doesn't have a lot of blood, it needs blood. Because we funded studies looking into blood types and how to safely transfuse an animal, those animals could be saved. Because again, you could bring a cat into me and say, oh, it has these fleas on it, and I think they suck blood, and look, its gums are white instead of pink. You know how to fix it because we looked at blood types and how to best give blood to a cat. That is a bridge that can be crossed. Whereas before we did not know about cat blood types and things like that. So it's just, again, the blood pressure I mentioned may sound like a frivolous thing to do for some people. However, I can think of a Persian right now named Odie who lives in rural Jennings, Louisiana. Thankfully, we were able to get flavored amlodipine for Odie, and some cats, if their blood pressure is very high, they'll be the vessels on the back of the eye, the retina can rupture and cause blindness. Odie went through that with his mom, but because we're able to monitor his blood pressure now, he has regained vision in one eye and it's controlled. So these things that I guess you empower a cat lover to feel like they can help their loved one. Wonderful. That's like one of the best things ever. You help the cat, which you love and care about legitimately, great. And just like anything else, we need to sometimes have buy-in, especially when not everyone has unlimited funds to say, I want to test this and I want to buy this medicine for my cat. If we can put research behind it to say, in this many cats this has helped, or in this many cats, or if you control blood pressure, it can extend the life of your cat's kidneys by years. It makes the owner, the cat lover, more supported in their decision for their dollars and their efforts, especially when you're trying to get a cat to do something new, knowing that, okay, I see the payoff in spending this money and making this effort for my cat, who doesn't look at me wagging its tail saying put it in peanut butter and I'll eat it. So I really think that research being there helps veterinarians, helps the animal caregivers feel empowered, which ultimately helps the animals. There was, when you asked about what I'm excited about, something came to mind. Maybe it'll come back to me, but this is one that at least where I am. So I've gone to lectures in California about CBD in animals. So there was Elevet is a company that partnered, I believe, with Cornell University to develop certain products for dogs that were tested by the university. So when you have that kind of academic research backing, it makes the veterinarian more comfortable prescribing it. We have some kind of proof, if you will. So I work with a cat rescue down here, and actually my veterinary technician who helped me set up my computer, so I would be here technologically sound today, she swears by it for the cat she's used it with. And so it's legal and everything, but we just don't have research to say what doses, when to use it. So that's we are as of the last grants we funded were in the spring of this year. There is a study we're pairing with a university in Australia to really put black and white facts behind that topic. So again, as easy as it is to medicate cats, when you have the options of this will help this much and help this much in this many cats, and it comes in a liquid dropper, it helps you make that decision of, okay, I see the proven benefit of that in this species, and I think a liquid dropper could work for my cat. You're more empowered with those facts. But again, to be able to give, for your vet to speak confidently on something, for you to have the chance to do your own research and potentially buy in on behalf of your fuzzy loved one, those studies need to be there. So we are excited to, you can imagine you can get proposals on a lot of topics, but it really has to have the meat to it, like the team that's doing it right. And the animals are, of course, handled right. And the science is there. So we are excited that we're putting our toe in the CBD world with this study for cats specifically, and we'll see where that goes.
So One Health has become a growing topic in medicine. What does One Health mean to you?
Yeah, I think it's the world we live in. I think if your eyes are open and you appreciate nature, you realize how everything is a part of everything else. So I guess growing up, Captain Planet was like a cartoon that I liked. So it's a reminder that we're all connected, and it's not even, I would say, just emotional or subjective. There's the objectivity of where our food comes from affects everything else. So I just think that we only stand to benefit each other, different species, different lines of work, what have you, if we share the things we learn. I understand patents and all that as well, but I also, as far as just things that, like what we do, what we fund, those publications are available to anyone that can benefit from them. So it's definitely, I think it's not a trend, it's a term, it's a truth that was always there, and it's good as being highlighted, would be my take. Maybe in the vet world, the thing that tied it together for people is like, humans can get rabies, so you need to get your rabies vaccine. It's very true. I found, like with COVID, I had people who just wanted, or as COVID was fading away, I had people who wanted their vaccine so their dog could get groomed. That's fine and good too, so they don't get something at the grooming salon. But also, rabies is still fatal to people. If you try to ship an animal somewhere, you're going to encounter issues with those factors. And then this could be a whole nother podcast. Hope I'm not taking up too much time. Screwworm is a parasite you may have heard of that stands to impact. Potentially, it could affect humans, but it is a big threat to the cattle industry. So it could, just one of those parasites, if you will, can condemn a whole carcass. So it's just parasites affecting animals, affecting the impact on humans. It's there, and I'm glad we're finally giving it a name, nurturing the study of the connectivity of all these things.
Mm-hmm. So why is the collaboration between veterinary and human medicine becoming increasingly important?
I think that not only can we learn from each other, I think that pet ownership isn't slowing down. And, of course, veterinary medicine is not just pet ownership, it's the food supply. You forget, like, there's oyster farming and there's deer farms, and we have veterinarians that are developing drugs that, aren't always tested in animals initially, but veterinarians are more so in demand, yes, in the small animal space where it's more companion benefit, but things aren't slowing down as long as kind of, back to your previous question, as long as there's a connection between animals and people in the environment, and I think we're understanding the benefit and roles they all play together. So I never thought about it till you asked. I think that One Health is becoming more important because we're realizing on the small animal ownership side, the benefit they add to our lives as just a companion and whatnot. Then you got your service animals, or I remember a dog that could detect when an owner's blood sugar was dropping, or detect seizures. So as we see the benefit animals play in our life, even just in that small animal model, we see the value in let's take the best care of them. And, I want to spend more time with them. Let me take the best care of me. And then the providers for those things, it just is kind of going up to hopefully advance research to help us all live better lives together.
Mm-hmm. So let's see. Can you share examples where research in animals has benefited human health and vice versa?
Yeah, wow. I will say a lot of times the medicines I prescribe can be called into like a local pharmacy. So no doubt a lot of your medicines have trickled down to human medicine. So that's the human side, all the advancements they've made. So I think one thing we mentioned is EveryCat studied transdermal or on the ear mirtazapine as an appetite stimulant. Well, mirtazapine, the drug for appetite stimulation and whatnot, was developed on the human side. So veterinary medicine has definitely benefited from the trickle down of all we know in human medicine coming to us. So again, I graduated 12 years ago. We're trying to learn things that you may encounter in your life as a vet. Not everyone's doing horses or meat inspection or radiation oncology. All those things, particularly like a topic like radiation oncology, came from, oh, we see it benefits humans. Let's bring it back to could it benefit animals? So definitely the veterinary medicine has benefited from studies on the human side. On the animal side, again, as we are documenting studies like studying feline coronavirus and how it helps with the development or the discovery that remdesivir could be used against this strain of virus, that's a benefit. I think there's a lot of studies where they're looking at cognition changes in dogs and people. In the small animal world, we call it cognitive decline, is like their dementia. So I know there's been pig valves used in hearts, or I know someone who had like a pig tissue, of course, developed sterilely and whatnot, kind of to supplement some tissue in their mouth. So definitely translational things and the crossing of benefit from the different worlds has been looked at. So yeah, we're more, I guess, related than we think.
Yeah, not only that, but there's also a benefit of time and cost.
Yeah,
because you're don't having to search for a new drug for everything.
Right, you're well said. Yeah, good point.
So one reason I wanted to have you on the show is the fascinating research involving feline leukemia treatment and its impossible application to long COVID. Can you explain how this research began?
Yeah, so feline leukemia virus was found around the 1980s, and so we were. That was one where we are still looking for a treatment. Feline coronavirus is actually the one that we're studying to see how it pairs with long COVID. So a lot of feline viruses can be kind of overlapping, but it's feline coronavirus is the virus that the studies for that going back 60 years, more recently the treatment in the 90s. Those studies in feline coronavirus is we're seeing how those treated cats how the course of their life played out after treatment. That is a model for how long COVID could and may affect people. So it's actually a feline coronavirus drug, but that's fine, no worries. Feline leukemia. No, you're fine. Feline leukemia remains a virus that we're working on. We do have people coming feline leukemia and feline immunodeficiency viruses are right now not curable. We can, those cats may need to be seen twice a year instead of once a year, or because their immune systems have these incurable viruses, we may modify, say, hey, they should not go outside, or let's, make sure if they have a cold, we treat them right away because they just have these hurdles affecting their immune system.
Mm-hmm. So how does the coronavirus affect cats different than humans?
So that's a good point. So we primarily see cats. So just like I know I think you can get tested for the flu and there's like a type 1, type 2. So the viruses do break down into those categories. In cats, we tend to see gastrointestinal disease, or that's exposure. So a cat that gets exposed to the most common feline coronavirus tends to have maybe a little stomach upset and they get over it. Other cats, for some reason, though, they get it and they get very sick from it. So it tends to be a GI issue initially. I know on the human side, just from what I learned on the news, not an MD, I know we had a respiratory route as well. So I would say more so we feel like it's gastrointestinal in the cat side. Again, they don't read the book, there is some concern that it could spread other ways, but primarily gastrointestinal transmission signs. That's what we've seen more commonly in cats. Dogs can have their own strain as well. So it's definitely a family of viruses that any knowledge that can, or any knowledge that can be contributed to the bucket of understanding coronaviruses is tremendously valuable. And we're glad that the research for cats was able to help humans when COVID-19, became the issue it was.
Mm-hmm.
And still is.
Yeah. A lot of theories on that, but I don't really want to say right now.
I hear you. It's still talked about, we'll say.
Yeah, but so are there a lot of variants like there are in the human version?
Yeah, and we're actually
with
learning
animals.
Right. Yeah, we are learning that as well. So I mentioned it kind of earlier, there was an outbreak of feline coronavirus disease in that Greece Cyprus area. It was acting different than the ones we know. So the question is, what's going on over there? Has something mutated? Of course, we want to help the cats. We want to help the people caring for the cats. But we just, as a scientific community that cares about coronaviruses and the impact on any of us, want to know what's going on there. So we did see a change in the virus there. So it's a long way of saying we are studying it well. In this case, we acted on it when it got our attention versus a disease that plagues the species for a while, and then we do what we can to learn about it. We're glad EveryCat's bigger. We were able to partner with another foundation to say, hey, let's get together to tackle this versus seeing how it plays out and then the devastation that could be there. So long way of saying, we do know there's different strains of feline coronavirus. We are continuing to learn that. That outbreak was in the past 3-4 years. And then, yes, the human side is we're learning our own as well. And again, canine has it. I'm sure other species have it as well. So those viruses they're tough. And there was a time, as I speak with other veterinarians, where we just didn't know you could cure a virus at all. And so it's really exciting that we found hope on the feline side with this specific family of viruses that helps the human side.
Mm-hmm. So do they have a shot like they do with humans, or?
No, we haven't gotten there. Good question. So one thing that the disease that comes from coronavirus in cats, it can be, just a quick summary, when they get the disease, they either get fluid, oftentimes they get fluid in their chest or their belly. If you pull that fluid off, it's usually highly suggestive of the disease. However, not every disease reads the book. It can be very expensive to diagnose this test in a cat, or this disease in a cat, because sometimes it affects the eyeballs or the nervous system, which are not as easy to sample, So what we're hoping to, from the outbreak of the virus in the Greece Cyprus area, that research we did, our hope is, could there be a blood test that you do in the clinic and you get your answer? So we're hoping to take all the research on that and make testing easier, so we screen it, so we catch it earlier, so things are more cost effective. So this outbreak in the Greece Cyprus area, tragic. Thankfully, it didn't take more cat lives. What we learned from it, could it then help cats in the US and other countries be more easy to screen, more or cheaper to test as well? And then also, there is the hope that we could one day work towards a vaccine. So not there yet, but we're on it. It's actually right now at this past grant cycle, we funded more so looking at the test to make that more cost effective and quickly accessible. But the dreams of the vaccines are there too.
What made researchers think that this antiviral might have a potential beyond feline medicine?
Yeah, so I think when you come down to like the name of a species or the name of a virus, it's Latin. It's a family. Before we break it down to what species are affected by it, it is ultimately the basic model of that virus. So because a branch of the virus Coronaviridae affected cats in this way, it's like, okay, well, cat feline coronavirus and human coronavirus share some similarities. Why not play that card that helped the cat people and the cat lovers and the cats? So that's where it kind of comes back to in my mind is if that family of virus showed that it is susceptible to this drug, it is a chance to help our species that's being affected by its subset.
Mm-hmm. So where does the research currently stand?
Yeah, so right now we're grateful that not only were our researchers, Dr. Peterson and his team, able to find the class of drugs that helps, the question then became, how do we get it in a cat? How do we make it affordable? How do we make it legal in the U.S.?
Yeah, and Dr. Placer, thank you so much for taking the time to join me today.
My pleasure.
I really appreciate you sharing your experience, your expertise, and introducing audience to the work of EveryCat Health Foundation.
Thank you.
It was fascinating conversation, and I hope it helps our listeners better understand how advances in veterinary medicine can also contribute to human health through One Health approach. If you enjoyed the episode, please subscribe wherever you're listening to a podcast. Follow Reconnection on YouTube on your favorite. Or remember the podcast. Share this episode is one of the easiest ways to help us reach patients, families, researchers, and healthcare professionals around the world. Until the next time, remember that every connection has the power to inspire hope. I'm Joanna, and this has been Reconnection.
Thank you.
Thanks.